ACEVO is the Association of Chief Executives of Voluntary Organisations. We're a network of over 1,500 chief executives of not-for-profit groups. Our members include the leaders of large household charities and small but vital local charities. We provide training, connections and support to help leaders to make the biggest possible difference. As we've all navigated the worst impacts of the coronavirus outbreak, people across the country have relied on community groups and charities for the essential support they provide. And we'll all continue to rely on charities' expertise and experience in the recovery effort that lies ahead. Our response to the crisis must match the values of our country and our hopes for a more equal and compassionate society. What we do and how we allocate resources will only be effective if we include the people, problems and places that are too often overlooked. The work our sector does and our relationships with communities shows the need to strive to meet everyone's needs and rights, now and during the recovery. In this video submission, you'll hear from 10 of our members talking directly to you about the challenges they've experienced, the hurdles that lie ahead, but also their aspirations and hope for building back better. Thank you for taking the time to listen to them.
So firstly, the huge amount of suffering and pain caused by the pandemic is of course front of mind for us, particularly as we represent the 7.4 million people in the UK today living with heart and circulatory disease. And it's those people who are at significantly higher risk from COVID-19 of both severe complications and sadly death. And with the BHF facing the largest challenge it has in its 60-year history, we face difficult times ahead. So I'd like to set out 3 areas that give us both hope and require government attention. So firstly, we've all had a timely reminder of the excellence of the UK's biomedical research sector and how central it is to the nation's health and prosperity. UK researchers have made important breakthroughs in the global search for a vaccine against COVID-19, and the entire research community has pulled together to understand as much as possible about the virus and its effects. And at the BHF, we're really proud to have funded significant flagship projects, including through our partnership with the National Institute for Health Research, to look at the link between COVID-19 and heart and circulatory disease. And we've done this despite the serious financial challenges we face. The coronavirus pandemic has already had a profoundly damaging impact on the BHF and our ability to raise funds. Throughout the lockdown, every single one of our 750 shops and stores on high streets across the UK was closed, and we had to cancel much loved fundraising events. As a consequence, we've been losing over £10 million a month during lockdown, and devastatingly anticipate having to lose both up to 300 of our staff, and also halve our research investment this year from £100 million to £50 million. And I'm really worried that won't just be devastating for the research that we fund and the pipeline of discoveries that we hope will be generated to help heart patients, but also that it will significantly and irretrievably damage the pipeline of talent and progress that we make in the cardiovascular research community. And that's why we, as a BHF, are working across the charity medical sector to call on government to partner with us and set up a life sciences charity partnership fund, a co-investment scheme which would see the government match charity funded research pound for pound over the next 3 to 5 years, providing long-term sustainability for the amazing science we're proud to fund as the largest independent funder of cardiovascular research in the UK. Without this fund, we genuinely think that there will be so much damage to the research progress and to our research ecosystem that actually it will take many, many years to recover. The second thing I'd like to highlight to you is the government's recognition that improving health of our nation is critical if we're collectively able to deal with this and future pandemics much better. And as lockdown measures are eased, we're at a critical juncture for how we deal with air pollution. There's a real opportunity to unlock access to active travel and the many other benefits that brings to our health. And lastly, but by no means least, The strength and the resilience of the NHS has shone through this period of challenge, and we've been heartened to see the continued public support for our NHS colleagues. Innovations developed during this period, such as the rapid deployment of digital cardiac rehab, have the potential to improve outcomes in the long term for millions and millions of people. And the fact that our health and care systems are working together more collaboratively and at pace have set the scene for a joined-up approach to health and care in the future. However, we know that the NHS continues to face huge pressures, particularly as the threat of resurgence of Covid-19 coupled with winter pressures looms large. And this time round, it simply won't be sustainable to divert all resources to Covid-19 patients. People living with long-term conditions such as heart and circulatory diseases have missed out on vital treatments and care during lockdown. And this risks their health deteriorating and ultimately placing a further burden on resources when they access care at a later stage.
Are there any positives I would take from this pandemic? At the start of the pandemic, we had to very quickly refocus all our hospice provision into the community, where we saw the need was greatest. As we now work on restoring the hospice-based services, many of the innovations made in reaction to the pandemic may remain in place and are helping us to learn from our experiences and take this learning forward for the benefit of our patients and their families. What are the things that I'm most worried about? Financial sustainability. Like many, our income generation almost stopped overnight, and as we now look to reopen our shops and restart our fundraising, we are concerned that the financial support may no longer be there. There are so many charities in the same position, and not all will survive. What do I most hope changes for the better? As a hospice, the support we received from the government during lockdown was extremely positive. Our local commissioners have also, maybe for the first time, fully recognised and understood the difference our services make, and I hope this understanding continues and contract discussions in the future are more mutually beneficial. Thank you.
At the peak of the pandemic, half of the UK workforce was working from home. The ways in which employers have changed their ways of working have irrevocably demonstrated that there is flexibility in many, many more jobs than those that are currently offered on a flexible basis. Some employers have already made permanent changes. Parents have told us they don't want any return to business as usual, with more than 9 out of 10 looking for more flexibility in their future working lives. There's a real opportunity to harness the increases in productivity, diversity and the recruitment talent pool that flexible working brings to the UK economy long after the coronavirus pandemic has run its course. But the pandemic has also lifted the lid on all the things we have long been worried about in our labour market. Parents in insecure work have been left without a safety net at a time of crisis. Pregnant women and new mothers have experienced even harsher discrimination. Families newly reliant on social security haven't been able to make ends meet, and women have overwhelmingly borne the brunt of meeting caring responsibilities, while childcare and education settings have been closed. We saw an immediate and sustained increase in demand for our free legal advice as COVID-19 unfolded. For many families, the consequences of the last 6 months will be felt for many years to come. We've seen also the false walls between work and family life being torn down, whether that is a well-timed request for biscuits during a national news interview or children popping up on the legions of video calls up and down the country. Given that the UK has 13 million working parents, the government needs to end this same false separation and recognise caring responsibilities in economic policymaking.
National Ugly Mugs provides victim support to adults in sex industries, so on and off street, and people across adult industries. What's been a positive thing through the pandemic has been watching how this population has remarkably come together to support each other, to share resources, to develop and share mutual aid, in part because of necessity, because we didn't provide comprehensive investment in individuals who work in informal economies. One of the negative things that I worry about going forward is, because these populations already experience stigma and criminalization and marginalization, that any support going to these communities cannot be leveraged to further control and further limit their freedoms and their choices. I think that we've learned clearly that there's a lot of disparity, that there's been a lot of work done across sectors, particularly in the third sector, because that's what we do, but there's a lot of disparity between those who have resources and those who have nothing. And if anything, through the pandemic, we have seen those social divisions amplified, and they are gaps that we knew were there. So it is our responsibility to make sure that we fill those gaps and we close the distance between those who have the best opportunity to survive and those who do not. And so my hope for the future is that we come together as a country, that we learn about the inequalities that we create. We don't need to. More than ever, we breathe one air. We share breath, we share space, and we have to pull together to make sure that as many of us as possible survive.
I think there are some positives coming out of the pandemic. We've seen communities and individuals be very generous and kind and care about and look out for each other. As an organisation, we've had members of the public get in touch, offering support, sending messages of support, giving donations, being very generous. Another positive for us is that we've been able to quickly move our services online. We've long wanted to make more of our digital offer, and we're using platforms like WhatsApp, like Zoom, to connect with young people across the country and to create a sense of community for many young people who are otherwise quite isolated. Another positive for us is that we've been able to respond to the increase in demand, and I'm really proud of the staff team who have been there and been able to support the young people that need us. In terms of things that I'm worried about coming out of the pandemic, I am very concerned about the impact that this pandemic has had on vulnerable children and young people. It's affecting their safety and well-being, their mental health, and I think looking to the future with an economic downturn, it's going to further disadvantage young people who already face real barriers and disadvantages. Another issue is young people's mental health, which is being impacted across the board. For care experienced children and young people, it's exacerbating existing mental health problems, the anxiety, the isolation, the loneliness that comes with this pandemic. And I think that's really concerning for the future. We're hearing from social workers that there's been a real drop in the numbers of referrals to them for families and children, as with schools closed, with reduced health services, many vulnerable families and children are hidden from sight. And there are warnings that when the schools come back in the autumn, there will be a real rise in demand for help. And I think there's a real challenge there for local authorities in how they are able to keep children and families safe and give them the support that they need. In terms of hopes for the future and what we hope gets better, there have been some welcome moves. One is that government has been recognising that care experienced people are facing particular difficulties during the pandemic and has been listening to the experiences that they're having. Myself and a group of young care leavers met with the Education Secretary recently, and they told him that they felt like an overlooked and forgotten group. That needs to change. We very much hope the government will use the opportunity of the upcoming care review to bring about the wholesale reform of the care system that's so desperately needed, and to make things better for care experienced children and young people.
We're most concerned about the impact of COVID-19 on LGBTQI people globally and the organisations that support them. As existing vulnerabilities are amplified by the pandemic, my charity GiveOut launched an appeal the LGBTQI Global Solidarity Appeal for Covid-19 to support LGBTQI communities during this crisis. And we've so far fundraised almost £50,000 to support organisations around the world. There are certainly some positives that we take from this crisis, and that includes how our community has come together to support LGBTQI rights globally at this time. We're receiving donations from individuals, businesses, standing in solidarity with LGBTQI people. And in terms of what we hope will change for the better after this, well, we want to see more of the same, that solidarity. We want to see LGBTQI groups prioritised in UK development aid. And we hope that governments around the world will stop scapegoating LGBTQI people and other minorities. And instead that we will all come together in the face of this crisis, recognising that we have more in common that unites us than separates us. Thank you.
Pilotlight has worked across the country over the pandemic and beyond, supporting small charities and social enterprises. We're just trying to work out what the landscape now means ahead, particularly for the voluntary sector that has played such a key role. And I guess we've picked up 5 trends that I would describe as ones that have been shaped or accelerated by the pandemic and that will go forward. First is that, yes, charities and community groups are needed more than ever, and this need will grow. Our programmes at Pilotlight are designed to work with business to give long-term organisational development support for charities. So when the lockdown landed, we waited to hear what our charity partners needed. Only 1 or 2 said they wanted to step back for crisis reasons. Everyone else valued that strategic support. And on the back of that, Pilotlight ran all the services we would have done, but working remotely and adding additional support, for example, through peer learning, leadership through crisis sessions with around 51 charity leaders. And it's been inspiring to see the role that charities have played in their community. And their track record will be of benefit to the society going forward. Yet trend 2, charity sector income is likely to reduce and jobs kind of with it. And when social and economic stress and distress hits, for example around mental health or unemployment, the need to be met by charities will grow at a time when the income for charities seems set to decline. Estimates of 10 to 12 billion net income across the charity sector kind of being lost, but that is short term, while trading income and voluntary income are also significantly reduced. We have seen trusts and grant funders step up, but actually with capital markets unsettled, their own investments are likely to be knocked too. And with exceptions, individual giving, if that tracks the economy, again is like to be flat or to fall. So our partner charities are questioning really around longer term funding and the need for a stable framework of support for infrastructure for the voluntary sector. The third trend is that we have learned and we are innovating, and the crisis has forced an adaptation for services in response to both opportunities and challenges. The fourth trend is that all of this adaptation is coming at a cost. For all that hard work and the motivation, what we hear from the chief execs of our charity partners is that they are acutely concerned about the mental health and well-being of their staff. And who supports the well-being of those chief execs too? It's often said that leadership is lonely. Well, it can be more lonely and more demanding now, and there is a real risk of burnout. And the fifth trend is that the future could be collaboration. We've certainly seen an increased appetite for collaboration, new forms of partnerships between charities, business, public sector organisations, community businesses. Magic Breakfast, for example, usually run breakfast clubs in schools, during the lockdown, it has expanded its partnership with Amazon to distribute food to local children, and they're working out what distribution model works best for them in the future.
If there are any positives that we would take away from this pandemic, it's certainly the resilience and responsiveness of the charity sector, and specifically the ability of our organisation and staff to adapt to completely unprecedented circumstances. Suzy Lamplugh Trust runs the National Stalking Helpline, and within a few days the helpline was up and running, offering support to victims of stalking as we had prior to the start of lockdown. We turned around our plans for National Stalking Awareness Week in April to create a virtual awareness week and increased engagement more than we ever had before. We've moved to online delivery of our personal safety training courses, which was more important now than ever, given that there are more lone workers working from home. We also developed a campaign specifically aimed at the increase in violence and aggression at work as a result of the pandemic. The unique nature of the charity sector is our connection to our service users. They need us to be there whatever is going on externally, and we have shown that we can adapt and change as necessary, including adapting in difficult and challenging financial times. And this is one of the things we're probably most worried about at this point, is long-term financial stability. As other charities, we've experienced a significant loss of income. Grants that were aimed at dealing with the emergency response had very little recovery funding available. And service development grants that ordinarily would have been made available were redirected towards responding to the pandemic. It does feel like there's been a lack of long-term foresight about what recovery looks like. At the moment, the majority of funding that we have been able to access as a result of the pandemic runs out at the end of October. What happens after this is unclear. It's unlikely that our other sources of income would have recovered, and victims that we support will still be experiencing the impact of the pandemic.
The positives that I would take from this pandemic are the speed of thinking and agility in response from the people working in the charity sector, as well as the vital kindness of peer support. The Ancient Tree Forum's own volunteers, staff, contractors and trustees have brought new ideas to life, events, information, and have developed relationships online to make sure that we can support people who are managing and caring for ancient trees out there in our landscapes. I'm positive that the Ancient Tree Forum and those we work with can remain adaptable and agile. Peer support, and particularly when looking for ways to change for the better, has been vital for me, and this has been shared from chief executives, from freelance workers, sometimes on a pro bono basis, as well as from infrastructure bodies such as ACEVO, NCVO and the Small Charities Coalition. I think our agility as a sector and our boldness through the pandemic has enabled charities to be ambitious and open, and this has been seen in my own charity's response to the Black Lives Matter movement. We've shared learning with other charity chief executives, we've built support amongst our volunteers, and we're collaborating with other environmental charities to make sure that the whole sector improves our diversity. I'm most worried about the long-term trends in our environment being overlooked in the rush to meet the needs of the very urgent but relatively shorter-term pandemic. In 2013, a remarkably troubling report, The State of Nature, was published, which suggested that the UK is already one of the poorest countries in Europe for safeguarding our biodiversity loss. This report didn't include detail on the losses of ancient trees, but it was the most comprehensive report on biodiversity loss across all species ever produced in this country. And with many environmental charities collaborating and sharing their decades of vital and unique data, it's this collaboration, foresight and vision that is needed for our future. This biodiversity loss is despite the huge love we all have of nature. And it's not just been seen in lockdown, but for the last decade. The 12 largest UK environmental charities have memberships totalling around 8 million people. As a nation, we have a huge love of nature, but it's not enough to love nature. We need the fundamental drivers of nature loss, of biodiversity loss, to be addressed urgently by all of us.
firstly, the positives we would take out of the COVID-19 crisis would be definitely a much better relationship with local authorities. I think there's been a recognition of the value of small charities, the value of working in partnership, and I certainly can't remember a time when we've worked with our local authorities on such an equal partnership level. The second major positive of the period is certainly the levels of innovation that have been shown and the embracing of technology. At Dingley's Promise, we very quickly pivoted to be able to provide our families with online support, both to children and to their parents. We used a number of different types of technology to do that. And what was really striking was not only the amazing ability of staff, who usually are face-to-face, and that's what drives them, but actually those staff suddenly switching to online support, and in many cases being surprised at how well they did it. And I think secondly, the families that we work with, and certainly in a wider context, the service users or beneficiaries of charities, the switch has been very, very fast. They certainly at Dingley's Promise, our families have fed back that they've really appreciated the support they've had online, which is something we wouldn't have done before. The situation, however, has brought up a number of major worries. For us as an organisation, firstly, it's got to be the impact it's had on children with SEND and their families. Children with special educational needs and disabilities and their families are already more excluded in many situations than mainstream children. But this was on a whole new level whereby families suddenly had nothing. Certainly research by the Disabled Children's Partnership found that nationally 76% of families of children with SEND said that all support fell away during this period. Now for our families that level was much lower, of course, because we'd supported them. But even among our families, they said Dingley's Promise were the only people who supported them during the period. Bear in mind, these families include those with children with medical needs. So some medical needs may take up hours of someone's day, and those families would have no respite at all, no short breaks, no services to send their children to. Those services, short breaks especially, keep families going usually, and so the period was extremely tough for those families. The Disabled Children's Partnership's research found that the mental health of families with children with SEND declined by 70 to 80% during the pandemic. Now, certainly for us as an organisation, seeing the impact at a very local level, we can also see that a number of families have really struggled with their mental health during the period. And again, this is something that we have to now look at in the aftermath of what's happened. And also I think there needs to be a recognition that for some families, lockdown is very much not over and won't be over until September. And my third worry about COVID-19 is certainly the resilience of charities. I would never say charities should just exist. Obviously, charities are there to support people in society who really, really need it. The vital nature of charities has never been more clear. The challenge that we faced as a result of the pandemic was huge, and it was often small local charities who were there in the community, making sure that people were not forgotten. However, now we can see funding that was given for charities from the government. So far, under 25% has actually reached those charities. A number of charities are now laying people off. Some charities have closed already. I really worry about the future of our sector, not because our sector should have jobs, but absolutely because the demand for our services has gone through the roof at the same time that the funding has gone through the floor.